Histopathology is the gold standard for the diagnosis. So the tissue diagnosis is really the final diagnosis. So this is what radiology or cytology or a clinical diagnosis are measured against as the gold standard. So it is pretty much the final diagnosis. However, it depends on whether the sample that has been taken is truly representative of the lesion or of the disease from where the sample has actually been taken. So the clinical context and the representativeness of the sample is most important in making an accurate diagnosis. It might be missed if the sample is not taken from the correct area. Also, it is worth bearing in mind that there is a failure rate as for any test. Rarely histopathology or a cytopathology diagnosis may be incorrect because there are lookalikes of a lot of entities which may mimic malignancy, or a malignancy which might look like benign or normal tissues. And this is where experience comes in, and this is where additional tests like immunochemistry or molecular testing may be used to ascertain a diagnosis or refine a diagnosis further. But like any diagnosis, a histopathology or a cytology diagnosis has to be made in the correct clinical context, being aware of the patient's symptoms, the physician's findings, the clinical diagnosis, its correlation with radiology, and of course the correlation between cytology, histology, and any additional tests such as molecular tests or flow cytometry.